Hey everybody, welcome to this episode of Compassion and Courage, Conversations in Healthcare. I'm your host, Marcus Engel, and this is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. I am really excited today to have Dr. Kathy Reeves on the show with me. Kathy, thank you so much for carving out a little time to share with me today.
Absolutely. Thank you for finding time to invite us. We're very excited to be here.
So I guess we should say that you are the new president and CEO of the Gold Foundation. Can you take us back to just a couple of months ago when you were named this position?
Sure. So I have been very fortunate in my career. I am a pediatrician. I have spent my career really working in pediatric emergency rooms and pediatric hospitals. I'm a pediatric hospitalist. And I've also spent a lot of time in medical education. And what I've realized throughout my career is that what is really hurting people in healthcare isn't that we don't know which antibiotic to give or we don't know the science behind what we need to do. It's it's the humanism part. It's the connection. It's, can people really trust us? Uh, do people feel safe? And do people feel like they are really cared about? Both the patients and the healthcare professionals. And my career, I was at the Lewis Katz School of Medicine at Temple University in North Philadelphia for 20 years. And my career morphed into research and education around that. And I really thought I would retire there. I was very happy. And then the opportunity came to be able to bring a national voice to the importance of healthcare that's kind, healthcare that's trustworthy, and healthcare where people really feel like they are cared about. So, um, so that's how I ended up. That's the 30,000-foot view of how I ended up at the Gold Foundation.
Well, thank you for that. And we interviewed your predecessor, Dr. Richard Levine, a year or two ago on the podcast. And so, for those who were not familiar with that episode, tell us a little bit about the Gold Foundation and what the Gold Foundation does.
Sure. So the Gold Foundation is almost 40 years old. Uh, and it started with a pediatric neurologist, Dr. Arnold P. Gold, and his wife, Dr. Sandra Gold. When Arnold, even before there were electronic medical records, even before we had so much digital influence in healthcare, before we had MRIs and PET scans, Arnold started to notice that the connection between the healthcare professional and the patient was being replaced by talking about the disease, by talking about the electronic medical record, by talking about whatever it was. He saw that long before it became even evident to most of us. And he saw that when he was taking care of a young man, a teenager with a brain tumor, and the residents and students he was working with knew everything about that young man's disease and knew absolutely nothing about that young man. And when that happened, he said, we have to do something. We have to create a place, he said, that protects humanism. I think we're even bigger than that now. We need to bring humanism back. And 40 years ago, he started with the white coat ceremony. Anyone who's had someone in medicine probably knows what that is. It's when you start medical school. There's a ceremony where you get your white coat before you're even a first-year medical student. Arnold and Sandra started that because they thought graduation was too late to take an oath that you were going to be committed to humanism in the care of your patients. And then they created the Gold Humanism Honor Society, which recognizes graduating students who are the most humanistic in their class. The way we tell that is their classmates say, who would you want to be your doctor? Who would you want to take care of the people most important to you in your life? And over the last 40 years, Sandra and Arnold and then Rich, they created this amazing foundation that has become the the beacon and the place that keeps healthcare human. And now I have this great opportunity to take it to its next step.
So, at the very basic level, we're trying to just get humanism back into healthcare, right? We're just trying to get connected with our what makes us human in healthcare in a system that can be difficult, confusing, overwhelming, painful, etc. How I know you talked about the white coat ceremony. How else does the Gold Foundation help bring that human being in the bed so that they're not just the disease, they're not just the injury?
Sure. So before I get to that, I just want to reframe what you said
Mhm.
for a moment. And you talked about, and I said it too, but bringing humanism back into healthcare. And I want to reframe it just a little bit because I want part of my leadership of the Gold Foundation to lead to an understanding that there is great science behind healthcare that takes place in a space that is safe and in a space that compassion and kindness are there and where people feel cared for. I keep saying that, but there's science behind that. There's a even just a small story. It was written by the physician who developed the defibrillator, and he was in a room with a collection of his residents, and one of his residents said her TS is stable, and it was just a language thing. Up till that point, this woman had tricuspid stenosis. She was progressing well. She was really doing everything she needed to do and managing this disease quite well. And what she heard when he said TS was terminal situation. And the communication and connection there didn't happen. And over the next few visits, her health just deteriorated. And it wasn't until someone just sat down with her and said, "What changed?" that they found out what changed. There is science behind the healing power of connection. So I don't want to just bring humanism back. I want humanism to be seen as something that is just as important as this antibiotic or this procedure. And that when it isn't present, it leads to the lack of health. And so, with that said, to talk about what else the Gold Foundation does, it is all in that vein. So, I think it really started with this idea of creating rituals, creating celebrations that remind us of the importance of the human connection, like the white coat ceremony. And then it moved on to recognizing exemplars and champions and then supporting them. We are behind what's called the Leonard Tao Award, which is an award that's given um, to faculty and students in medical schools because of their humanism. It is in over 120 medical schools in the country right now, and it is thought as the preeminent award. And then we want to support people who win the Tao Award to then be champions in their institutions to move that mission forward. Um, and then over the last few years, the Gold Foundation has added to its number. There's a lot of awards like that. There are opportunities for ceremonies. There's the Gold Humanism Honor Society, which has been in place for 20 years now, that has almost 50,000 members. These are the champions in healthcare today that we want to move, that we want to help move the mission of humanism forward. Um, and then the next step of this is to bring all these people together and create practical opportunities that health systems and hospitals and clinics can adopt that make the human connection not just possible, and at times possible, but it's still really hard, but the default. Our goal now is to help change the culture of medicine so that human connection is more likely than not, and to show people there's science behind why that's going to make people healthier. And I believe, though we need to prove this, that it's also going to be more profitable than the way healthcare runs right now.
There's a lot of evidence behind that, right?
There is, and it's disparate and unfortunately ignored. So my job is to bring all of that together. This is all evidence based. We just aren't, as a healthcare system nationally, paying enough attention to it.
There's so many different levels of and silos in healthcare that to bring them all together is going to take uh, something really big and dramatic. And I love that the work that you're doing that's trying to bring in not only the humanism in the clinical encounter, but also into the greater community. And I was reading a little bit today, and I'd love you to share a little bit about the Center for Urban Bioethics, I believe. Did I get that right?
Yes, you did. So,
And how does that relate to humanism?
oh, sure. I think that is the whole reason that led to this job for me. So, the Center of Urban Bioethics was something that I started with a colleague, Dr. Nora Jones, who's an anthropologist, um, almost 15 years ago. And we started it after conversations with Art Kaplan when he was at Penn and running their bioethics center. And the reason that we started these conversations was our realization and how egregious we saw the way society viewed health disparities. So we're in the middle of North Philadelphia, one of the poorest parts of any city in the country, one of the ground zero spots for the opioid epidemic and rampant gun violence. There are lots of struggles in North Philadelphia. And we have some of the least healthy people. We have one of the largest differentials in health, in life expectancy in the country. There's over 20 years difference between whether you live in North Philadelphia or whether you live 4 miles away around City Hall.
20 years difference in life expectancy.
Yes.
Wow.
And I think what we were talking about is people are desensitized to the disparities that happen in communities like North Philadelphia. Well, that's just North Philadelphia. Even with the number of people who died from COVID, we weren't as upset about how many people died in communities like North Philadelphia as we were sometimes about people who died in some other communities. And I say this because I don't think we as a society are intentionally doing that. I think we're desensitized. We've accepted that disparities exist in communities like that. And what the Center for Urban Bioethics, so it's the only urban bioethics center in the country. It's a full bioethics center that talks about all the bioethics issues, but it urbanizes it. We want to people to realize these disparities are unethical. They aren't just they just are not present. They are not ethical. So we highlight that. And we created a master's degree in urban bioethics where medical students and residents and lawyers and law students and nurses and physical therapists come together and they get this master's degree. It's really not meant to sit alone as a master's degree. It's meant to augment their ability to do their job and to realize how unethical these disparities are. And it is our responsibility to address them. It shouldn't ever be okay that we talk about we'd rather have a patient with this insurance rather than a patient with this insurance. It's never okay to discharge a collection of people with a medication that needs refrigerated when they don't have a refrigerator. That has to be automatic in what we do. And that's not, I think Temple is really committed to their community. I think that happens all around. They let us create this center. They let us highlight this problem, which I think is to Temple's great credit. So we created the education degree, and then I'm an academic at heart. So then we created research around it, and we we asked our local community. We really engaged with the people in North Philadelphia, and we asked them, "What's the biggest barrier to healthcare?" And they looked at us and said, "You're asking us the wrong question. You need to ask us what is our biggest barrier to health." And that was clear and reproducible. It was violence. It was opportunities for their children, education based on property tax, school differential between communities like North Philadelphia and other communities. It was the substance use problem, which wasn't new in places like North Philadelphia, violence and food and housing insecurity. Those things were clear. And that's where we centered our research with our community, with our community support. So the Center for Urban Bioethics is really an academic center looking at creating health equity through acknowledging and then addressing health disparities as unethical.
I love that you're kind of breaking this ground, right? To say that this is unethical for us to have these disparities, and really in our country, one of the wealthiest nations on earth, there should not be a 20-year difference in just because of a zip code or the other side of the tracks, so to speak. What is your research turning up, and how can it be applied?
Yeah, so we've done a number of different things while I was at Temple. We were part of an international program called Cure Violence that looked at violence as a public health issue, where we hired people we called credible messengers, folks whose lives had been negatively impacted by violence. They're probably people who had been in prison because they took part in violence, who were from North Philadelphia. We hired them, we trained them, and we treated violence like a contagious disease. The CDC has said that for over a decade. Violence is contagious. So just like a pandemic, um, we trained people to find out, so where is it starting? Who are the people that are starting the violence? Who's most at risk? And how can we move people at risk away from the contagion? And how can we mitigate, how can we stop the infection from happening in real time? So what that means is credible messengers being in a space in North Philadelphia when violence is about to happen and having the credibility to stop it. It means meeting with young people who believe they don't have a future, but convincing them that yes, you do, and helping them get an education, get a job. And we saw in North Philadelphia a 30% reduction in shootings in cure violence sites versus non-cure violence sites. It was real. Cure violence,
Significant.
it is significant.
Yeah.
And it's amazing how hard it is to get public health oriented violence prevention programs adopted because they're expensive to do right, yet they still will save an awful lot of money, not just in healthcare, even more so in criminal justice and in economic development. These are hard sells, though, politically, to get people to invest in this as standard of care. It's still all grant supported. We need it to be more than that. And and we had some of the same results with school-based programming, looking at understanding how traumatized the children in our public schools are. And if we If we create programs that don't look at our kindergarten through eighth graders as bad children, not even as children who do bad things, but as children who had bad things happen to them, we can change the dynamic for the teachers, the staff, and the students. Um, and last thing I'll say is food security programs. You know, I, I am often quoted as saying we should never be celebrating an anniversary of a food bank. That's a problem. We don't have a lack of food. We don't have famines. We don't have food apartheid. We don't have any of that because there isn't enough food in the world. We have that because of how it's distributed. And if we can create a place that everyone has the right to food, water, air, and education, then the world changes. And I know I'm getting a little off here, but I'm
That's
just
okay. Please, please, because that's what we're all looking for, right? We all want the safety of being in a community with all of our needs met and without fear that walking down the street is going to end in something tragic. I think that's just what we all want, right?
right. And I think we all want that for each other
Hmm.
if we can understand it. You know, I think when people really understand how unethical these disparities are, they're driven to change them. And we just aren't so good at shining a spotlight. And we aren't so good at creating, at least in our lane as the Gold Foundation, the healthcare systems that are set up to be able to not just mitigate, but create equity in these situations where people have less, not just equality, but real equity.
How did you're very passionate about what you're doing, and that shows through in your words and your tone, and I'm very happy to hear that. How did you get so passionate about uh, this outside of I mean, I can imagine that as a pediatrician you're happy seeing kids, but you're probably seeing kids that come out of pretty bad environments too, and a desire to change those. um, when did that start for you? Was that before med school?
You know, it's kind of interesting because I grew up in a really small town, a coal mining town in the middle of Pennsylvania. And I saw so many disparities in that rural space. And my goal going to medical school was to go to medical school and come back and make a difference in a rural space. Um, and in all honesty, um, I just fell in love with the urban world. And then I saw the same thing in the urban spaces. And I had my first real job in Chester, Pennsylvania, it's just a little bit south of Philly. And it's one of the poorest mid-sized cities in the country. And I also was the pediatrician assigned to take care of children who were victims of maltreatment. And I'll tell you, I didn't meet a parent that woke up that day saying they were going to hurt their child. And not that that's not an egregious thing to have happen, and that we need to protect children, and children cannot stay with caregivers who hurt them. But it's so much more complicated than that because these parents, it's a generational thing. It's what their situation is. It's so much more complicated than that. And our systems aren't so well set up anyway to take care of children, even when we need to create different spaces for them. So I think it came to me by just seeing so much concentrated suffering in the urban spaces. You know, I saw it in the rural world, but then when we get in urban distressed communities, it's so concentrated, it's so clear. Um, and these are really good people trying their very best who don't have the minimum of what they need to succeed. So I think at that point, I just really started looking at what do we, so much of it, it's so much easier to prevent um, illness and hardship for people when they're children than it is to change it once they're adults, which I'm sure is what has drawn me to pediatrics. Um, and as I've gone through my career looking at that, I just think we have to acknowledge, I think it's true everywhere we turn for the most part. These are not bad people. These are not even people doing bad things. These are people who've had bad things happen to them. And our healthcare system, my goal now, my very focused goal now, is to get that point across when we are able to share healthcare with people and and help people understand when they're coming to us, that's who's in front of us.
That's who's in front of us, right? And oftentimes there are people in front of us and we just don't see them, right? Part of the time is that it's convenient not to look. It's convenient not to look at the struggles of another, but um, we can't turn a blind eye to that for much longer as a society, I don't think.
Well, and I think in healthcare, what we've come to realize is, you know, I graduated medical school in 1991, and I think the teaching back then was clear. We need to separate ourselves. Do not overconnect. You can't be too connected to your patients. That's not a good thing. I don't think that's a good thing for us. And I think it's much healthier that we do connect, that we form relationships. There's no way caring for another person in their most vulnerable moments can be void of relationship. And our need as medical education back when I was trained to separate those has created part of the problem. That's that's worse for us as healthcare professionals, and it leads to our moral injury, to our burnout if we don't connect. So um, I think we're better at that now. We still have a long way to go, um, but yeah, it has to be about connection.
So let's talk about that connection a little bit more. I think you know that I am an adjunct at Notre Dame, and I get to teach pre-meds humanism, compassion science. And at the beginning of the semester, each student has to write a very short two-page reflection paper um, on a question that I'll pose to you. That's the same one that they get at the beginning of the semester, and that is, can you share a time when you were there for somebody else, or that someone was there for you during, as you said, a vulnerable moment?
Sure. So I think to share the moment um, that I was there for somebody else, I was a pretty young new attending. I've always been um, practicing in hospital medicine, and there was a young man who was I was called down to see in the emergency room because they had brought him in because he was seizing. And when I got down there, the emergency room physician had said to me, uh, this child has a long-term seizure disorder, and the mother's not following the recommendation of the neurologist, and we want to file with Children Protective Services.
Mm.
And the mother's standing there, she's hearing all of this. Um, and I think the best thing I did at that moment was I just turned to her and said, I gave her the benefit of the doubt. I assumed she wanted what was best for her son. And I said, so tell me, why are you doing something different than what your neurologist said? And she said, because it makes him worse. And as we went through the whole process, her neurologist wanted him on a ketotic diet. He hadn't been diagnosed. the disease he had, a ketotic diet, did make worse. And my being there for that mother and that young man was all about just making this assumption that she wanted what was best. And in that moment in time was a thing for me, because from that moment forward, I always do my best. I say before I walk in the room, I take a moment. I still practice some hospital medicine in North Philadelphia. And before I walk into a room, I will always say to myself, whoever is in there wants what's best, either for themselves or their child. Because sometimes that's hard. Those are hard situations. That has never failed me. And so I think the thing I did for that family was make that assumption.
A good assumption. As you said, the benefit of a doubt. And when we just take the time to listen, maybe it doesn't have to escalate to the point of feeling like we need to file reports. Maybe if we listen to our patients, right? And that brings us back to humanism, being in the moment together and respecting one another as human beings.
Yes, absolutely.
Well, in the time we've got left here today, are there any other organizations or work that you'd like to highlight? Because your bio is long and varied, and I don't want to gloss over anything because there's so much great stuff in there. Is there anything else you'd like to highlight?
Well, I don't think it's about, I think I've been very fortunate in my career, and so much is about the people I've been very fortunate to meet, the opportunities that have been put in front of me. Um, what I really want to highlight, I think, is the opportunities we all have collectively to make change. I know it feels very large. It feels too large. Uh, I do believe, though, when something is right, when something is good, when something is shown to work, there's great power there. So, uh, we could highlight all sorts of examples of that, whether it's in what I had done at Temple before I came here, or other people have done elsewhere. Um, but I'm all about a call to action. And I guess what I'd like to do is just take a few minutes to talk with folks who may be listening to this about what we can do together to try to bring this change.
Yeah, I want to know what I can do.
So, so I think we all, as patients and as communities and as healthcare professionals, as healthcare workers, whatever role we play, and some of us play multiple roles, we need to understand we are worthy of care that is safe, trustworthy, and kind. Now, some of us have more choice than others. Some cannot have choice. My friends in North Philadelphia have very little choice, but some of us have great choice about where we can go. Our voice matters. When people want how did the patient experience this? That matters. When you tell hospitals and clinics and healthcare professionals your experience, that matters. So tell people what you want, what really matters, and be granular about it. So I I ask that people go onto the Gold Foundation site. There's one program called Tell Me More. You can read about it. I think every hospital in the country ought to have this program. It's a program, it's so simple, but it makes such a difference. And we've had partners study this. It is as simple as having this big sticker that goes on the wall of a hospital room where someone spends some time with a patient and writes down 3 things that are really important to that person that have nothing to do with their disease. So the first thing that people see when they walk in the room is this person is a gardener, they love the Jets, and they have 3 grandchildren. And what that means is the first thing that happens when that nurse or that physician or that wonderful person bringing them their food tray, the first thing that happens when they come in the room is they ask something about that. It leads to connection. So,
Simple.
so tell your hospitals, your clinics, your doctors, your nurses that that needs to happen. And then I have a call out for the healthcare community. Um, One of the ways that we're trained way back, even though I'm old, when I started, it's still the same. We talk about when we want to talk to a patient about their history, we do something called CC. Some we used to call it chief complaint. Some people now call it chief concern. But let's think about that for a minute. In what world would we want to connect with someone? Would we start with something that's a problem? Tell me what's bothering you. Let's change that CC to create connection. Consciously have your first comment to that patient be something that's not a problem, and then move into that. I do that as a hospitalist. I take care of patients, families who come up from the ER. Nobody's thrilled to just have spent 12 hours in the ER. And if I walk in the room and say, so tell me why you're here, that doesn't work very well. But if I just say, oh my gosh, you must be tired. It's so great you're here with your child. Can I get you a glass of water? Is there anything that you need? It changes the entire dynamic. And studies have shown again and again, it can take less than 40 seconds to make connection that changes the whole interaction. So my two calls to action are: patients, demand it. You have a voice. And we believe we have ways to do that. Look on our site. And healthcare professionals and workers, create connection first.
Love it. Love it. I want to ask you the last question today. Thank you so much for spending this time with me and educating me and the listening audience too. We've talked about a lot of kind of high level things today. So, if you had the ability to have your message distilled down to, say, the size of a billboard that the whole world could see, what is the message that you would like to broadcast to humanity?
That every person deserves dignity, compassion, and trustworthiness whenever they find themselves in their most vulnerable space.
And all of us are going to find ourselves in that vulnerable space at some point in our lives. And I'm really glad that there are people like you who are um, really putting humanism and that dignity and trustworthiness and compassion at the heart of the very sacred clinical encounter.
Well, and I want to thank you for what you do. I mean, you get the message out there. I've had a chance to listen to a number of your different segments, um, and I very much respect what you're doing, and I'm very grateful for your passion and commitment.
Thank you. Thank you. I always like to collaborate with like minded organizations and like minded people. And I think we found that in one another today. So thank you for spending the time with me, Dr. Reeves.
Thank you.
And listeners, thank you for being part of this episode of Compassion and Courage Conversations in Healthcare. This is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. Please visit marcusengel.com for keynote speeches, consulting, or books. And thank you all again so much for being part of this episode of Compassion and Courage.